Pete here with allorganicmedicalmarijuana.com and allorganiccbdoil.com. Just wanted to give you some highlights from Luke Shultz from the Medical Marijuana Advisory Board meeting. What I'm going to do is I'm going to have this as best I can because other times I actually can't fit the whole transcript. YouTube only lets you put a certain amount of letters. It's 5,000. And Luke, he does a great job providing all the notes. So he typically has way over that. But I'm shortening this a little bit, and I'll try to go through it as quick as possible. So basically at the meeting, there are two new board members introduced, Mr. Patel and Mr. Steffen, which is a PA Chief of Police Association. There's also a 13-question online survey that was conducted. 3,201 people took the survey between January 9th and the 28th. The results will be online very soon and available. Dr. Rachel Levine gave an update on EVALI, the e-vape products. Keep in mind, all those illegal e-vape products are what cause people to get sick. Nothing legal. Everything in the medical marijuana segment is tested. Also, if you get other vapes from local stores, 99% it should be fine. Not telling you not to worry about it and smoke whatever you want, but keep in mind, good sources typically don't have tainted products that you're selling, so they have a warning to tell you about that. Dr. Levine also announced that there would be 8 academical clinical registration centers. 3 of them, I guess, are approved, and 5 are in process of getting approved. And right now there are 23 approved conditions that you can get a medical marijuana approval for. And each clinical registrant is allowed to have 6 dispensaries. So no applicant came for any changes or anything. And if you are looking to make any changes for any serious medical conditions, it's May 12th to the 26th of close of business to add, change, or modify any serious medical conditions. Director John Collins gave an update of the program for patients and caregivers. They're monitoring costs. Until you start getting more supply, costs aren't going to go down because there's a lot of people looking for it. But let's see how they do with that. We're looking at patient safety, administering the law, and oversight of the supply chain, which we kind of just talked about. So there are a lot of things that are happening. A lot of departments are coming down on medical marijuana patients. That's why they're trying to preach more to law enforcement about this so they understand what's going on. And also they're trying to inform the patients that you have to keep your card on you, make sure your product's in the original container, and also keep your receipt. This makes it easier for you to explain things to a potential officer and hopefully get out of any situations that you might be in. So Luke also has notes here that says don't store it, so it could be a problem. Technically, you can get a DUI because the medical marijuana is in your blood. And that's been a big consequence for people that I've talked to. If that's happened to you, comment below. Let us know what's going on. We'd like to actually interview some people. So some people stated they've had issues where they've gotten in trouble. And of course, they haven't had any medical marijuana in a certain amount of hours. And of course, the police is trying to give them a DUI. But everybody knows medical marijuana is going to stay in your system for probably a couple weeks, not a couple hours. Since the last meeting, 5 more grower processors are shipping products. That's 15 out of 25. And 22 out of 25 are considered operational. So that should help a little bit. And one of the groups, Greenleaf Medical, is looking to expand to 280,000 square feet. It's pretty ambitious. It's probably a good thing, but if HB 350 comes, they better be grandfathered in because that won't be legal. All right. So by the numbers, there are 280 and 87,000 people registered for the programs. And that would be 26,000 are caregivers, and 266,000 cards have been issued. So he's got the number of sales and everything if you're interested in that. Ooh, and Director Collins also has some data that is kind of interesting. It looks like they've got 42% of the people are pain complainants, 14.9 are anxiety, PTSD is 12%, cancer is 6%, neuropathies is 6%. I'm giving the general breakdown here. Opioid use disorder, 3%. And damage to tissue is 2%. Irritable bowel disease is 2%. MS is 1.5%. Epilepsy is 1.2%. Crohn's disease is 1%, followed by other medical conditions at 1%. And it says anxiety continues to increase, but is much slower rate than is to close to plateauing. Right? Opioid use disorder is also plateaued, so it looks like it's not going up. Next meeting is actually going to be Tuesday, May 12th, 10 a.m., and that would be in the Forest Room Meeting Center, Keystone Building, 400 North Street, Suite 114 East, Harrisburg. Thanks, Luke, for sharing this information. If you have any questions or comments about medical marijuana in Pennsylvania, comment below, like and share to support, and have a great day. It's Pete Gustis with allorganicmedicalmarijuana.com, allorganicCBDoil.com, and hopefully this news is helping you.